In this video, I'd like to talk about some relevant vocabulary if you're going to learn anatomy. And that is something kind of unique to Hmong, and that's called shape prefix words in the Hmong language. So, many parts of the body are labeled or have a prefix that describes the shape of that object. Now, the point of this is not to give you a bunch of vocabulary that you can use for anything you want, but instead it's to help understand certain words that are used commonly for different parts of the body, to help identify them, and how Hmong people or how the Hmong language understands those parts, those shape words. Often, and as we'll see examples, a part of the body is used by using a word that is used to describe quite a few different things. For example, we'll just start with what we see on the screen here right away. The word ja, C-H-A, ja, ja. So ja is a ridge. So, for example, on the left, we'll have a non-anatomical example. So, for example, we have 架高中, 架高中. That is a mountain ridge or a ridge of mountains. But when we use it on the body, we use it in a couple of different places. For example, 架住, and that would be the bridge, or if we're being literal, the ridge of the nose. So, what's another example? A very common example is ba, ba, and that refers to a spherical protrusion, something that's round, spherical, sticks out. So a non-anatomical version of this shape is zhao ba. They call it the spherical protrusion vegetable or cabbage. As you can see, it's circular. An anatomical example is ba j. So J with a J tone is the word for the ear or relative different parts of the ear. It's used for example, the ear lobe. That word is used for the ear canal. But referring to the whole external part of the ear as a whole that pops out, that protrudes, and it's circular or spherical, they say ba J, and it turns into a G tone, that second word, because of the B tone in the word ba. That's another subject altogether. But in any case, ba is used for a few different things on the body, generally all shaped that way. Another example, ncej, N-C-E-J, ncej, which is a vertical column. Now, non-anatomical example on the left, nje, nje is a vertical column, so like a fence post, a column for a building, etc. Whereas on the right, part of the anatomy, nje boa, and that is the thigh. You can see it looks kind of like a column. It's vertical. Another example, tao, tao. Tao is a word for gourd or something shaped like a gourd in Hmong. So, for example, on the left, tao da, tao da, tao da. Normally, it would be a J tone for that second word, da, because it's yellow, orange. But the first, again, there's a tone change, so it's pronounced tao da, and that's a orange pumpkin. Whereas on the right hand side, anatomical version, tao hao, tao hao. Oh, that's the word for the head. So we have, again, the point of all this, we have a prefix word to help describe the shape of the head or the shape of that body part. Next, we have nqa, nqa, which is a beam. It can be vertical or horizontal in different cases. Usually it's a horizontal beam. But we have on the left an example that's non-anatomical. Che nqa, che nqa. And that is train, a train, which is shaped like a beam. On the right hand side, we have ca nqa go, ca nqa go. So that first word, ca, means bone, and nqa go, when you put it together, all three words refers to the spinal cord, or specifically the spinal column, the bones. Please disregard that word cord. That is a mistake. We're just referring to the spinal column, referring to the bone. Another example very commonly used, qhov, qhov. It refers to a hole, a depression, something that looks like a hole. So on the left side, we have lu kho is a hole. Lu kho, a hole. Whereas on the right side, if we were just talking about ju, that could be the nose. But when we say kho ju, that is the nostril. Another example, ga, refers to something shaped like a handle. On the left side, we have tu ga, the handle. So this is the handle of a knife. And on the right hand side, we have ga ta, which is the foot. So we see, if we think about it, the foot is shaped kind of like a handle, depending if you were to describe it after seeing a foot for the first time. Maybe you think it looks like a handle. Next, we have dong, which is the blunt side of something, or another word for ridge. Now, you may think of dong as mountain, but dong has another meaning, which is the blunt side of something. I think the easiest way to describe that, and most common, is when we refer to a knife. So a knife has a sharp side, but the back side of it was called dong dia. Dong dia. And that's the blunt or back side of the knife. You could do that with an axe too. You could say dong dao. That would refer to the back side of it. But again, it doesn't necessarily mean the back side. It means the blunt, non-sharp side. So on the right hand side, we have dong lao. Now, certainly not the back side of your calves, but it's your shin. So it's kind of like, it's shaped similar to the blunt side of a knife. If you think about it, it's got that ridge. So again, dong lao refers to the shin. Lastly, I included this example because it is in Annie Jasser's Hmong for Beginners book. I personally wasn't able to find an example outside of anatomy for the word da, which in her book she refers to as a narrowing. So an area that narrows. However, so again, on the left, I don't have an example. Maybe there is one I don't know about. I'm sure there probably is. But on the right side, anatomically speaking, there are quite a few examples. So I picked one, da te, and it's the wrist or the narrowing of the arm. I hope that helps. This is a good introduction to approaching anatomy terms in Hmong, because most of the anatomy terms include some sort of a shape prefix, and understanding these in advance help you to grasp the way the Hmong language describes the body. And sometimes there's variations in the anatomical terms that certain people use from one person to another, but usually those variations are choosing a different shape prefix word. So if you understand the shape prefix words, you're likely to understand most of the anatomy, whoever you speak to. I hope this helps. I'll see you in the next video.